The next series represents 6 body and head acupuncture points for post-traumatic stress, calming, and centering. Governor Vessel 20 and Governor Vessel 24.5 are both identified on the cranium. Governor Vessel 20 from the inferior lobe of the ear along a line through the apex of the ear to the top of the head, the apex of the head, is a soft place where Governor Vessel 20 lies. Governor Vessel 24.5, between 24 and 25, is at the level of the glabella, between the brows. And if you take those two lines and intersect them, you will find that they intersect at the level of the hypothalamus. That is where we are targeting with Governor Vessel 20 and Governor Vessel 24.5, along with the surrounding deep subcortical structures. Large intestine 4, at the mid shaft of the second metacarpal, is at the level of the palmar arcade and is targeting the sympathetic fibers of the vasa nervura that innervate palmar arch. Likewise, liver 3 represents a similar point between the great toe and the second toe that targets the plantar arch and the vasa nervura, the sympathetic nerve fibers which densely innervate both the plantar and palmar arches. So in this way, we are targeting the sympathetic overdrive on the left foot and the right foot, the left hand and the right hand. We are balancing and centering left and right. With the arms overhead and the feet on the ground, we are centering the upper and the lower parts of the body. So we are calming the sympathetic nervous system, we're calming the hypothalamus and the deep subcortical structures, and we are centering. Governor Vessel 20 is identified at the midline, from the inferior lobe on a line through the apex of the ear, at the apex of the head, where it can affect the hypothalamus, infect the entire brain, and the deep subcortical structures. And it can have a calming effect, in particular when it's added to Governor Vessel 24.5, between the brows, at the level of the glabella, where it too affects the hypothalamic level in a calming fashion.
The needle insertion technique we describe in this protocol allows you to easily and swiftly needle the 6 auricular points and 2 head points where the guide tube is used for proper insertion, and the needle is adjusted solely so that it holds itself firm and is not at risk of falling out of the skin. However, for the 4 body points that are part of the protocol, 2 in the hands and 2 in the feet, we will insert the needle using the guide tube into a subcutaneous depth. Then we will advance the needle millimeter by millimeter so that the tip of the needle is able to penetrate the fascia and overlying muscle fibers to achieve a sensation called DeQi. This sensation is important in the sense that it gives full benefit for calming and centering. But I do want to talk a little bit about the layers of skin and tissue that you should have in your mind's eye when inserting and then advancing a needle in the body points. As you see here, we have the skin composed of the epidermis and dermis. The dermis is where the nerve endings will be located, which give a sense of pain. So the quickness and swiftness in which you're able to insert the needle below that dermal layer into subcutaneous fat and loose connective tissue, the pain-free sensation your patient will experience. Once that needle is inserted and the guide tube is removed, you can now grab the handle of the needle and advance it until you approach a layer of fascia. Many times this is felt as a saran wrap or a slightly different texture as the needle tip is advanced. In the case of the body, once you advance through the loose connective tissue, there is more of a glide or ease of movement of needle. And when you approach fascia and the first few muscle layers, you'll feel a saran wrap sensation or a thicker resistance. It's very subtle, but we will help guide you to get this under control. Once the needle tip has been advanced into the fascia and upper muscular layer, the patient experiences a sensation that is known as DeQi. It is described here as achiness, soreness, pressure, heaviness, tingling. I now want to focus on the hand points we will be needling. In this diagram, you see the point large intestine 4. It is located between the first and second metacarpal in the muscular groove of the interosseous muscle. And the proper technique for needling with the guide tube is to place the guide tube over the skin where you want to insert the needle. Secure it with your non-needling hand, then tap in the needle, remove the guide tube, and now you can advance the needle until you feel that glide through the subcutaneous fat and loose connective tissue and approach fascia and the upper muscle fibers to arrive at a DeQi sensation. This may only be 1 to 3 millimeters. In the foot point, we have liver 3, similarly located between the first and second metatarsal in the interosseous muscle, as more proximal as possible before it becomes fibrous. When we move to the head point, we have a slightly different goal. The direction of insertion of our head point, governor vessel 24.5, will not be perpendicular to the skin, but rather on a 45-degree angle. Governor vessel 24.5 is located between the eyebrows or glabella, and while we place the tip of the guide tube at this point, we angle it 45 degrees going down towards the bridge of the nose. The second head point, governor vessel 20, located in the midline, and from the apex of the ears going back into the center of the head. You may want to also insert this needle at a 45-degree angle, angling it anteriorly or forward towards the nose.